patient's name is Mr. Nick Daniel. This is a referral letter, and we are going to have a writing workshop. Right hip replacement is the case. Right. Hello. Hello and welcome to Seven Sentinels. Yes, all of you get ready. Take your notebook. Yeah. This is Grandmaster class and I am Peter Simon with you. Today we are conducting a writing workshop. Yes. The name of the patient is Nick Daniel. This is a referral letter and a writing workshop we are going to conduct, and the case is right hip replacement. 5 minutes to go. Get ready. Take your notes. And here is the case notes. Deepika, Chandigarh. Kiran, Delhi. Good. Vinita, Ramakrishna. Yeah. This is the case notes.
Yeah. Now what you have to do is you write in the chat box what information is relevant. Then I will underline that one. Relevant information. So relevant information. So underline. So you can write them so that I can highlight the information. Yes. What is the relevant information in this case notes? You can just write down there. Nick Daniel. Yeah, is it, Kiran says sender's name, profession, address, today's date. Okay. Now you are a nurse. You are in the orthopedic ward, Roland Hospital. Patient name and date of birth. Important. Age is also important. Okay. Come on. Sender's name, professional address. Okay. Sender's name is here. You are writing to, yeah, Joel Ortner, and he's a physiotherapist in City Med Physiotherapy, 8 Albert Street, Dubbo, New South Wales. Okay. And what else is irrelevant information? Come on, pick and choose fast. Tell me. Okay. Letter writing date, discharge plan 26/9/7/2019. Patient name and date of birth. Yeah, diagnosis. Where is diagnosis? Diagnosis is osteoarthritis of the right hip or right hip osteoarthritis. Come on, select. What are the reference important information you can requirement. What is requirement? Yeah, he requires what? Request him to teach. Refers a discharge. Yeah, your discharge plan is there. Refer to the local physio. This is a referral letter, and you are writing to the local physiotherapist. Local physiotherapist here. Okay, City Med Physiotherapy, 8 Albert Street, Dubbo. Okay, come on. What are the other things which are important? Purpose of referral. Yeah, what is required? Yes, discharge plan is always important. Controlled analgesia and calcium supplements. These are compulsory and is ready for discharge. Yeah, today. Date of admission. Date of admission is where? Date of admission. Where is date of admission here? Is an inpatient in the ward. So where is date of admission here? Yeah, this is presenting complaint. This is a date of admission you can take. So write whatever post discharge care. Yes, come on, all of you write down allergy. What are the allergies? Where are allergies? Okay. So this is education. Request him to teach. So teaching means education is required, or counseling required, or guidance is required. Teach how to walk with a walker or scratches, and then participate in weight bearing exercises and using the stairs safely after full recovery. Yeah, this is the purpose. Okay. Assistance to increase the mobility. Assistance to increase mobility. Okay. So hip replacement surgery performed on 19th. Yes. Assistance to increase. Spelling mistake, Kiran. Assistance. ASSISTANC. Assistance to increase. Two spelling mistakes. Three mistakes in one. 5 words you have written, in that 3 mistakes are there. Assistance to increase mobility. The is not required. Increase spelling mistake. Assistance spelling mistake. To be a little careful. Yeah. What else? Admitted in the hospital on 16th. He presented here on 13/5, then 12/6, then 16/7 he was admitted in the hospital. Yeah. He was admitted for hip replacement surgery. Okay. Yeah, reason for admission is because his hip replacement surgery scheduled for. It's not scheduled on, but it is scheduled for. Scheduled on means which date it was scheduled. Scheduled for means on which date it will be done. So be very careful. Whenever you are saying like this, you have to use for. Come on, what more you want here? Which must go into the letter. Okay, penicillin allergy. Yes, please. Okay. Yes. What are the other points which will go into the letter? Yeah, first let us take single page, okay? Yeah, file, save as. One hundred and three. Yeah, so this is our quality check answer sheet. Yeah. Now we are going to write the 7 components again. Yeah. So you're going to write the address. Just let us see here. This is the address. Dr. Joel Ortner. Are you writing to Dr. Joel Ortner? Just a Joel Ortner, Mr. Joel Ortner. Okay, not doctor, right? A physiotherapist. So, Mr. Joel Ortner. Do we need to mention allergies to the physiotherapist? Okay, come on, respond everyone. Give your voting the same question. Okay, let us. Srija is asking a question. So let us everyone answer to this question. Do we need to mention allergies to the physiotherapist? Physiotherapist is related to the exercise or body's physical condition. All of you. Do we need to write about allergies? Okay, allergies. Then what about medications? Should we write about medications? You can describe about your story. Yeah, come on. Do we need to mention allergies to the physiotherapist? It's okay if it is right or wrong, no problem. We'll discuss, na? Yeah. So here we get Joel Ortner, copy text. So Joel Ortner. So we don't know. So Mr. Joel Ortner, that's all. Mr. Joel Ortner. Next, physiotherapist. P capital letter. Physiotherapist. Next one, city med physiotherapy. Yeah, city med physiotherapy. This is how you have to maintain the left margin. Albert Street. 8 Albert Street. Write in full. 8 Albert Street, write in full. Dubbo. Dubbo. Then NSW. NSW means what? New South Wales. Yeah, New South Wales. So we finished with the address. We finished with the address. Right. Come on, write in your notebook. Yeah, one step finished. Because you are participating. Is there anything change you require? You tell me. Then afterwards, we'll have to write the date. Next one is the date. Leave one line and then write. Whenever you are changing components, leave one line and write. Yeah, today's date, 26th July, 2019. 26th July, 2019. July 2019. Now here is a point, how to write the formal date. In a formal date, when you have a formal name, you have to use the formal name. So July is the formal name of 07. So write like that, 26 July 2019. That is the date. That's how you have to write. This is the formal style of writing the date. This is the formal style, official style of the writing the date. Because sometimes if they tell, for example, date is written like this, 09 dot 08 dot 2023. Suppose this is the date. Now what you will say, it is 8th September or 9th August. Because some countries they will write they'll write the name of the month first. Sometime some countries write name of the date first. So date first. So confusion like this. So therefore it is mandatory, but formal letters you have to write July rather than 07. Next, number 3. Okay, salutation. Dear Mr. Ortner. Dear Mr. Ortner. Dear Mr. Ortner, comma. Here itself, Mr. Ortner. Dear Mr. Ortner. Okay. Then leave one line again. This is subject line regarding whom? Regarding whom? Regarding whom? Regarding Mr. Nick Daniel. Regarding Mr. Nick Daniel. Here it is. Copy text. 68 years of age. So Mr. Regarding Mr. Nick Daniel, comma, date of birth, colon, immediately and space. After colon, there should be a space. Date of birth is this one. Copy text. 11/5. So you will write it as May. 11 May 1951. 11 May 1951. Yeah. Next we will write the body. The body of the letter. So we're going to write the body of the letter. Okay, let the body of the letter be like that. Then so let us think a letter, body of the letter like that. Okay. Fine. Okay. Now next, again leave one line. After the body of the letter, leave one line. And to whom are we writing? To Mr. Joel Ortner, name of the person you know. So it is yours faithfully or sincerely. Yours. Come on, write down all of you, faithfully or sincerely. Should we write faithfully or sincerely? The name of the physiotherapist is given. Okay. Next question. Sincerely should be capital letter or small letter? Sincerely should be capital letter or small letter? Yeah. Here sincerely. And comma. Here sincerely and comma. Then next to leave two lines. 1, 2. Because you leave one line normally and the signature, another line you can leave. 1, 2. Okay. And now who you are? You are a nurse. The orthopedic department. You are ward nurse or registered nurse. No problem. So you are a nurse. So let us take registered nurse or ward nurse. Registered nurse, not registered nurse, registered ED Kiran. Okay. Registered nurse. Registered nurse That's fine. Then next, orthopedic ward. Okay, orthopedic ward, O capital letter, W also capital letter, O capital letter, W capital letter, orthopedic ward. And the name of the hospital is here. Copy text. Yeah, Roland Hospital. Yeah. So orthopedic ward, Roland Hospital. Yeah, there you go. So we have finished. This is point number 1, address. Point number 2, date. Point number 3, salutation. Point number 4, subject line. And point number 6, yours sincerely. And point number 7, sender's particulars. Okay, we have done everything except the body of the letter. Now let us participate in discussion. Okay, so we'll see organization also. We'll see organization. Now this is a referral letter. This is a referral letter. The patient is discharged, but this is a referral letter to the physiotherapist. Right. Now let us write the introduction. Introduction. Now all of you can tell me what points will go into the introduction. What points will go into the introduction? Yeah. Yeah. Next, second page. Write in the body here. Okay. Now name of the patient will go. Yeah. That's absolutely right. Name of the patient. What is the name of the patient? Mr. Nick Daniel. Now I am asking you, do you need to write the full name or not? Should we write the full name or not? Come on, discuss in participation, please. Come on. Discuss in participation, please. Yeah, in first paragraph, what we are supposed to do? Introduction. What we are supposed to do in the introduction? Name of the patient. Yeah. Present condition, reason for referral. Yeah. Diagnosis, complete name. Yeah, that's fine. I'll give you all the points. Mr. Nick Daniel is number 1. The next point is, yeah, somebody told what? Diagnosis. What is diagnosis? Now let us see the diagnosis. Diagnosis is what? Osteoarthritis of the right hip, or right hip osteoarthritis. Okay, this is the diagnosis. Okay, R hip means right hip. Osteoarthritis, right hip of the right hip. Osteoarthritis of the right hip. Okay, Nick Daniel. Yeah, you're absolutely right. Okay, name of the patient. Diagnosis: osteoarthritis of the right hip. Requirement: management, particular needs, place. Okay. Reason for writing. Yeah, this is a referral letter. This is a referral letter. This is a referral letter. Come on, all of you participate, please. This is a referral letter. Okay. Next, complete name. No, we'll need not write complete name. because complete name we already mentioned in the subject line. You have seen here. Me regarding Mr. Nick Daniel. Already we introduced full name. Now why again full name? No need full name. So type of the letter, that is a referral letter. We have written referral letter. Yeah, type of the letter. Yes, Nick Daniel. Yeah. So what is this, Mr. Nick Daniel? This is the name of the patient. Name of the patient. The name of the patient. Yeah. And this is the diagnosis. The diagnosis. Yeah. Okay, type of the letter. Letter, referral letter. Okay, the type of the letter. The type of letter. The type of letter. Okay. The type of letter. Okay. And the reason for referral. Diagnosis, purpose, current status. Okay. Let us take the purpose. The purpose. What is the purpose? Can anyone write what is the purpose here? The purpose is what? The purpose is what? Education regarding the exercises and using the stairs. What is the purpose here? What the physiotherapist should do following the discharge? Yeah, purpose. Physiotherapy. Yeah. To improve his mobilization. Enhance mobilization. Okay. For mobilization enhancement. Okay. Physiotherapy exercises for mobilization. Yeah, very good. Education and rehabilitative care. Yeah. Yes. So the purpose is okay, providing education, providing relevant education, providing relevant education. Okay. Okay. And the other purpose is compliance, compliance with medication, sorry, exercise regimen, compliance with exercise regimen. Then next one, use of walker, use of walker or crutches and or crutches. This is all purpose. Okay, next one is next one is using the stairs. Do weight bearing exercises. Do weight bearing exercises. This is one. And then using the stairs safely after full recovery. Using the stairs, using the stairs safely using the stairs safely, after full recovery. So, right. So this is all the regarding purpose, which is want feel important, minimize that one and write that. Okay. And next one is, when is his discharge? Following the discharge today. Okay. Where is he discharged? Where is he discharged to? Okay. Where is he discharged to? So you have to tell, is it discharged back home or to the care home or discharged to? Where did he where did he get discharged to? Next one. So you can say following the discharge. Following the discharge. Okay. And you can also say back home. Okay. Back home. Back home or not? Is he going to the same place or some other place? If he's going to the same place, means back. Otherwise, discharge to the back to your facility or back home. If it is coming from there and going there, then you. So remember that. So now you can write. Keep all these points in your mind and write your introduction. Yeah. Introduction will not write any designation, right? Yes, please. Come and write down your introduction. You can write in many different ways. I'll give you some examples. Okay. It can be starting like this. I am referring. This is one style which everyone is using. Okay, I am referring. Then next one is, you can say, thank you for seeing. Thank you for seeing. I am referring, thank you for seeing. Okay, the third style is Mr. Daniel, comma. Okay. Mr. Daniel. Yeah. This is one. Now this is related to one point. Then was diagnosed with. Who was diagnosed with? Or who was admitted to the hospital? Was admitted to the hospital. Okay. Was admitted to the hospital. Okay. Yeah, of course, Vinita. Yeah. Yeah. Vinita Ramakrishna says this is home visit. Okay. What do you say? Come on, participate in discussion. Is are home visits requested? Yes or no? Are home visits requested here? So just check. Not necessarily. Okay, the patient may go to the physiotherapy center, or the physiotherapist may come to the house, whatever. So here any home visit, is it mentioned in the letter? Check, Avil. Is it mentioned in the letter regarding home visit? So if it is not mentioned, it depends on the physiotherapist. The patient has to request the physiotherapist to come home, or he himself can go to the physiotherapist, the local physiotherapist. But home visit is not mentioned there, so no need to worry. It can be either the patient can go to the physiotherapy, or the physiotherapist can attend home. Anything is okay. Yeah. So, right, electrician Daniel called me just now. Good. Yeah. Next, what else you can say here? Maybe sometimes if it is possible, he can go to the physiotherapy, or if it is not possible, the physiotherapist can come there. It's according to the progress. Yeah, in the recovery process. Okay, you can say I am referring for, or he requires. I am referring for. Okay, I am referring for what? Or you can say Mr. Daniel requires. He requires. He requires. Anyway, there are multiple ways of writing. Anything, anyway, you can write. He requires. Okay. Yes. Next. Yeah, come on, all of you write your introduction, please, now. Kiran, what is the spelling of Daniel? You wrote Daniel. Daniel, see the case notes. Yeah, all of you can submit your. Yeah, now it is question answer session. Q&A. Q&A session. Yeah. Q&A session. Anybody who has any questions or doubts, you can just raise your hand and type your name so that I'll tell you to open your mic and you can ask. If you don't have any points, you can write the introduction. And if you have already written one style, you can write another style. If you have written two styles, you can written three styles. Learn different styles. No? Learn different styles of writing. Yeah. Now let me take one style here. Okay. First common style of everyone who is writing like this. I don't know why everyone writes like this, because it's an easy cake to eat. Why should I struggle? I'll cut. This is called format. Somebody gave me a format. Okay, skeleton. I'll write like that. That's it. We don't have any special. Okay, I am referring Mr. Daniel, comma. I am referring Mr. Daniel. Okay. Who? Now here, what stage is he in? So replacement is done. So who underwent? I'm introducing new thing. Who underwent right total hip replacement? So you want to write surgery or you don't want to write surgery? If you want to write surgery, don't use A. If you don't want to use surgery, you can say like this. I am referring Mr. Daniel, who underwent a right total hip replacement. I'm going to show you different styles, okay? Here it is, number 1. Okay. I am referring Mr. Daniel, who underwent a right total hip replacement. Or remove this and say, who underwent right total replacement surgery. So if you are writing surgery, don't use A. So now we are not given this word a total. We don't know whether it is total hip replacement surgery or partial replacement surgery. I don't know anything. So information is incomplete. So don't write total. So who underwent right hip replacement surgery? Information is given, then only you write. Otherwise, don't write. That's the point, what I'm telling you. Yeah. I'm referring Mr. Daniel, who underwent right total hip replacement surgery, or you can say a right total hip replacement. No need surgery, because A will not go with surgery. Okay. Okay, this is one. Next one is, I am referring Mr. Daniel, who underwent right total hip replacement. Sorry, total we are avoiding, right? Right hip replacement surgery. This is one style to writing. Next, I am referring Mr. Daniel, comma, I am referring Mr. Daniel, comma, who has been recuperating or recovering, who has been recuperating after right hip replacement, okay, or replacement surgery. Okay, same thing. A surgery, okay, if you want to write, who underwent a right, a surgery will not come after a right hip replacement. That's it. The same sentence can be repeated using a surgery. Okay. And next one. I am referring Mr. Daniel, who was diagnosed with osteoarthritis, osteoarthritis of the right hip, osteoarthritis of the right hip. All different styles I am telling you now. All different styles I am telling you now. What happened? 14 members became 11 members. What's wrong with these people? They'll come and in between not going. I'm telling you now, many sessions I'll be taking, so don't miss. Even our staff members are staying till 6, 7 o'clock. Wonderful. Okay. Mansi, very good. Vinita, very good. Kiran, very good. Geeta, very good. Srija, very good. Excellent. Jackson, good. Now, if you have already written one style, try to write in another style. Okay. This is using I am referring. Now you say thank you for another style is thank you for seeing. Thank you for seeing Mr. Daniel. No need of writing full name, okay? Thank you for seeing Mr. Daniel, who underwent a right hip replacement. Instead of I am referring, you are using thank you for seeing. That's all. So like that. Thank you for seeing Mr. Daniel, who underwent a right hip replacement. Okay. So like that you can write the first part. Next, second part you can write. Second part you can write like this. He requires what? Counseling or education regarding. He requires relevant education regarding. He requires relevant education regarding. Yeah. He requires relevant education regarding right exercises or physiotherapy exercises. He requires relevant education regarding the usage of walker. Education. He requires relevant education for enhancing mobility. or for mobility enhancement, or you can say for enhancing mobility or mobility enhancement. He requires relevant education for enhancing mobility, or you can say counseling or education, counseling, or training, whatever you want to say, however you want to use, you can use. So this is the next sentence. He requires relevant education for enhancing mobility, or you can also say like this. Anyway, your wish, how you want to write, you check that one, and based on that one, you can write. He requires, okay, necessary counseling with regard to using the walker, comma, using the walker, then compliance with exercise regimen and exercise regimen and exercise regimen and climbing the climbing up and down the stairs, up and downstairs, down the stairs after the complete recovery. So this is another sentence you can write. However you want to write, you can modify and write. Okay. If you finished one style, you write another style. If you finished another style, you write another style. Right? How many styles you want to learn, or you just want to do one speaking, one writing test? Learn. Why Simon sir is teaching all this? The purpose is very important. You'll get 3 points there. Here itself, you'll get 3 points. You don't know that. Okay. Hmm. Okay. He. So you can write in passive voice also. Okay. Education appropriate education to use the walker, crutches, appropriate education to use the walker or crutches, comma, mm, yeah, appropriate education to use the walker, crutches, comma, uh, participation in use the walker, participate in weight bearing exercises and climbing the stairs Okay. Climbing the stairs safely after the complete recovery is recommended. So appropriate education is recommended. That's what it is. He is being discharged back home today, or um, right. So you can write however you want to write. You can write as many styles as possible. No need, all those things are not needed. How many you want? You think, no, I'm writing many different people will write many different things. So I'm giving all the possible options which you can use. If you write all these things, the introduction only will become 200 words then. So no need. Yeah. So that is how you are going to write the introduction. So you can write however you want to write, you can write. Yeah. Now let us go to the paragraph number 1. Yes, body paragraph number 1. BP1. Body paragraph 1. Main body paragraph. The main body paragraph 1. So are you okay? What do you think about this session? Okay. Is this beneficial? Yeah, I will send you Mansi. Yeah. So this is quality check answer sheet. You have to, is this session beneficial or is it a total waste of time? Some people want to say, but they cannot say. I don't know. Is it a total waste of time? Mhm. Yeah. Okay. because one letter, just teaching one letter, it will take 15 minutes. I can teach everything and go, but I'm not teaching you, I'm training you. Okay, I'm not a teacher. I'm just not telling you do like this, do like this, do like that. I'm giving you various options, and it is your right to decide whatever you want to do. Main body, paragraph 1. Okay, what do you think we will write in the main body, paragraph 1? This is not an urgent letter, so you will tell about the visits, the first visit and the next visits, and how you will do all these things. Initially, he visited. From there, you can start. So, what do you think you will write here? Why my battery is done? Oh, battery. Please connect to this one. Yeah. Yeah. Now, urgent letter, you will write about today's visit. You have to write the most important visit here. Most important and the latest. First, you will write about the initial visit. Okay. Not today's visit. Not definitely today's visit. And it is not today's visit. It actually is admitted already, and today he is in the hospital and it is discharged. So it will definitely not be there. If only visits are there, you will write like that. Initial problem. What is the main problem? Initial problem that you have to write. Okay, now let us see here. What was his initial problem? See there. Initial problem. 2-month history. Initially presented with a 2-month history of severe pain in the right hip and knee. 5 years of trouble with right hip. Now think about this one. Which one you want to write? So F 5, 6, 7, 7. So 2-3 months ago. So a few months ago, whatever you want to say. He presented with the initially in May 2019, or initially on 13th May 2019, or a few months ago, Mr. Daniel presented with the complaint of a 2-month is presented with a 2-month history of, or a complaint of severe pain, or presented with a 2-month history of severe pain in the right, in both the right hip and the right knee. Whatever you want to write, you can write there. Yeah. Severe degenerative changes consistent with osteoarthritis. He was diagnosed with osteoarthritis. Okay, next, what else you can see here? So walks with limp. Walks with limp. That means difficulty to walk. So you can modify this one. Is experiencing difficulty with walking or mobilization or movement. Okay. Can write this one. Let us take this one now. So this is the date. Copy text. So this is the date. I'm giving all the information here, okay? That is slash, point is slash. Next one, presenting complaint. Okay. Presenting complaint is what? So this is 2-month history, severe pain in the right hip and knee. Okay. Whichever you want to write, you can write. And next, walks with a limp. Yeah. See, these are some points which you can write. Next one, copy diagnosis. Okay. Diagnosis. 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 Okay. Next. So treatment. X-ray right hip, degenerative changes concern right hip. So treatment is X-ray, part of that one. Okay. And based on that one, what you can identify is degenerative changes. Right knee normal. So no problem with that. Okay. Yeah. Okay. So these are some points which you can use there. And then what was the medication given for that one? TDS. Don't write this shortcut TDS. This is the treatment for that one, the medication given for this. Okay, initially, this is initial visit and initial before. So this is a presentation stage. We can say main body paragraph one is initial visits. Initial visits. So you can write main body paragraph one is related to initial visits. Initial visits. Initial visits. Yeah, you can write your paragraph here. or sentences here. I'm giving you points here. This is initial visit and the follow-up visits. This is the first visit and the next visit. You can continue there only in this paragraph. So you can see there in the follow-up visit, okay, what happened after this treatment. So here, 6th month. So flare-up of pain. 1 month later, okay, this is 1 month later. So 1 month later, this is first visit and this is second visit. 1 month later, what happened? What happened there? So flare-up of right hip pain. This is exacerbated condition. Write down exacerbated. What is the status of the word? C1 or C2? C1, C2. Find out. Exacerbation of the condition. Flare up of right hip pain. Flaring up means increasing the difficulty, increased difficulty. Exacerbation. You can say the word, you can use word exacerbation. Exacerbation. Can you please make some? Yeah, exacerbation. Deterioration of the exacerbation or deterioration, worsening. Synonyms, you can use all these synonyms. Exacerbation, deterioration, worsening, condition. So you can use these words. Okay. So little improvement in right hip, but increasing difficulty to get around. So increased difficulty, decreasing range of movement in right hip, decreased muscular mass. Okay. Now what happened exactly is, now here, he ceased medication 6 weeks ago. See here. Cessation of medication 1.5 months ago. Okay. Because of this, the problem happened. Okay. Cessation of medication. And the consequence was serious. He has stopped taking this medication without informing, without notifying the doctor or anybody. He took his own decision. Did not take any medical support, guidance. Okay. It was his own decision. Okay. Now, because of this, what happened? Indomethacin tablets 50 mg, same. Recommends indomethacin. So you have to write about this. Now what happened? Medication is not responding, okay, to anti-inflammatory medication. So now there is no other option. So for this reason, hip replacement was performed. Yeah. Yes. So now you can write one paragraph using these guidelines. Yeah. Write down your sentences, please. Mr. Daniel initially presented with extreme pain in the right hip. Initially, on 13 May, Mr. Daniel initially presented with extreme pain in the right hip. Come on, write down your sentences, please. Write any way possible. He experienced serious problems related to walking. He was diagnosed with osteoarthritis of the right hip and consequently or subsequently was prescribed and subsequently indomethacin indomethacin was prescribed. Indomethacin, here, see here, indomethacin 50 mg thrice daily. Indomethacin, we don't need to tell about this medication fully to him. Okay, indomethacin was prescribed. How many mgs? What everything is not needed. Only the important things you need to tell. Others all not necessary. How many grams? Okay, how many times? All these things are not necessary. Indomethacin, just superficial level you can give. Okay. A month later, a month later, a month later on which date? 12 June, 12 June, comma, on 12th June, comma. So this is the next visit. On 12th June, comma, he visited again with worsening symptoms. Worsening symptoms of osteoarthritis. Worsening symptoms of osteoarthritis. Think about more and more combinations. Very good, excellent participation. Come on, come on. Geeta Jayakumar, very good. Srija, very good. Kiran, good. Simyat, good. Kiran. Yeah, you can write one full paragraph or you can write one by sentence after sentence, no problem. So worsening symptoms of arthritis possibly due to the cessation of anti-inflammatory medication. Cessation of medication. Possibly due to the cessation of medication. This is how you can modify. Yeah. Cessation of medication. Yeah. Without consulting the medical authorities, without consulting the medical authorities. He decided to he decided not he decided he had stopped using the medication using indomethacin and consequently indomethacin and consequently the condition exacerbated. The condition exacerbated. A condition exacerbated. Condition exacerbated. So that's done. You can write in whatever way you want to write, you can write. Modify, change, or do whatever you want. Yeah. Next, we'll move on to the next paragraph. Next paragraph. This is body paragraph 1. Next, we are going to write body paragraph 2. Body, the main body paragraph 2. Yeah, the main body paragraph 2 will be related to what? The admission and surgery. The admission surgery stage or the hospitalization stage. Earlier, the visiting stage, this is the hospitalization stage. So I hope you understand how it is twisting. The main body paragraph 2. Since I'm bringing quality now. Till now I gave ordinary sentences, but now I'm increasing the quality of the sentences now. Since or owing to or as. Since the prevailing conditions were detrimental, quality words will go up a high level now. Since the prevailing conditions were the detrimental, since the prevailing conditions were detrimental to the healing process, the condition deteriorated further. The condition deteriorated beyond the normal the condition deteriorated beyond the beyond the condition deteriorated further the condition deteriorated further and serious measures were warranted to manage the condition, manage the situation. Yeah. Since the prevailing conditions were detrimental to the healing process, the condition deteriorated further and serious measures were warranted to manage the situation. On these grounds, admission was granted. On these grounds, he was admitted to the hospital and the surgery was scheduled for what date? The surgery was scheduled for 19th July 2019, for the next day, scheduled for the following day. Following day or successive day or on the next day. So on these grounds, he was 16th and 19th, sorry, not successive day. 16th he was admitted and 19th surgery was scheduled. Sorry, not on the following day. I'm sorry. Scheduled for, we have to write the name of the day, date, write the date, that's all. Scheduled for 19th July. 19th July. So on these grounds, he was admitted to the hospital on 16th July. 16 July. And the surgery was scheduled for 19th July. Yeah. So this is how you can write. So now here, between this hospitalization and surgery, there is the reason between this one. He was admitted to the hospital. So we'll put a full stop. On these grounds, he was admitted to the hospital on 16th July. Okay. Right. And what else? All the plans were done. Okay. So there was no improvement. The condition was difficult and decreasing range, movement of the right hip and decreased muscular mass. And the osteoarthritis was not responding to the anti-inflammatory medication. All these points. You have to put it in a nutshell. Okay. So now that you have to write here. Yeah. So sir, can we give comma before and? Yeah, you can put. Okay. So 16th July. Right. 16th July. Now here, after that one, Okay, 16th July. Now the continuation here. Now what was the steps taken after admission? Okay. After admission, what were the steps taken? Little improvement in right hip, increasing difficulty to get around, decreasing range of movement in the right hip, decreased muscular. Okay. So in spite of all their trials, treatment and everything, nothing is going on. And even the anti-inflammatory medication was not, okay. The condition could not be managed. Osteoarthritis was not responding to anti-inflammatory medication. All these things you can think about. Yeah. Decreasing range of movement in the right hip was noticed. Okay. The range of motion in the right hip was decreasing. Full stop. Next one. Next one is decreased muscular mass. The muscle mass, you can see here. The muscle was also decreasing. Right. The muscle mass was decreasing. Yeah, here you can say. So the range of motion. So here you both the sentences, not only the range of motion in the right hip, but also the muscle mass were decreasing. Not only the range of motion in the right hip, but also the muscle mass were decreasing. Not only, but also both were decreasing. Next. Next, this one you can write here. So you can continue the next sentence here. He underwent the surgery on 19th July. So on 19th July, on 19 July, comma, he underwent the surgery which was successful. Right. Underwent the surgery which was successful. Next one. Continuation here. So after that one, what happened? Now, post-operative physiotherapy was commenced. Okay. Post-operative physiotherapy was commenced. operative, physiotherapy sessions were commenced at the hospital. Yeah, at the hospital. First, by the hospital physiotherapist. Post-operative were commenced by the hospital physiotherapist. Yeah. So here you can write. Okay. Post-operative. Okay. Here you can say 2 days ago or on 21st, on 23rd, sorry, not 2 days ago, on 23rd, 19th and 23rd, today is 26, 2 days ago, yeah. On 27th, on 27 July, oh, 27 July, yeah, comma, on 27th July, comma, post-operative physiotherapy sessions were commenced by the hospital physiotherapist. And you can see here, uneasiness in hip area. This also you can write. And is prone for dislocation. Whichever important you can write there. Certain level of uneasiness has been experienced. Okay. Right. Certain level of uneasiness in the hip area. Sorry, which area? In the hip area. Yeah. So you can write the next paragraph. That is body paragraph 3. You can write about what the discharge plan and other things. These things refer controlled analgesia, calcium supplements, and weight bearing exercises, using a walker, and all these things. The guidance, all these things. Recommendations, post discharge recommendations. Main body paragraph 3. The main body paragraph 3. The post discharge education and training. This you have to write in the main body paragraph 3. Now you can write 2 paragraphs I have explained, and now you can write this paragraph. What you have to write here is, yeah, now you have to write about analgesia, physical therapy or physiotherapy to be continued until recovery. Okay. Physiotherapy sessions to be continued. I'm giving you the bullet points which you have to write until full recovery is attained. Okay, that is point number 1. Next point. Okay. So calcium supplements should be given. Calcium supplements. Okay, that is another point. Next point is education regarding usage of walker. Usage of walker. Next one is weight bearing exercises. This is very, very important. Weight bearing exercises. Next one. Using the stairs. Using the stairs. Okay, these are some points which you have to write. And next one, what else is there? What else is there? He is prone to dislocation. This one. Okay. This is careful. Okay, precaution. Precautions to be taken. Precautionary measures. Precautionary measures to be taken. To be taken since he is prone to dislocation. Okay, that's finished. The letter is done with. I hope it was useful for you. So, how do you rate this session? How beneficial was this? 0 to 100%. Okay. What new things did you learn today? Maybe I took a lot of time, but I think was it beneficial or a waste of time? Whatever you want to, whatever you feel, whatever you learned, write the points. I'm going to keep the platform for 1 minute. So you can give whatever feedback you want to give. I will take the PDF of this one and I'll send it to you. And the fourth paragraph is, last paragraph, sorry. Okay. In view of the above, so like that. 2 sentences you write in the last paragraph. In view of the above, appropriate guidance and excellent training is recommended for enhancing the mobility of Mr. Daniel would be in view of the above, providing appropriate guidance and excellent training is recommended for enhancing the mobility of Mr. Daniel would be profoundly beneficial. Okay. The next second sentence is, in case any additional information is deemed extremely relevant, please do not hesitate to contact me. Okay, that's finished. This is last paragraph. The conclusion. Yeah. So that is the conclusion. Okay, that's the end of the session. And I will send this. I'll just go for walking and I'll send this. I'll edit this and I'll send you in the Telegram channel and the WhatsApp groups. Yes. See you all again. That's the end of the session. Have a nice day. Bye-bye.